So a lot of people are interested in kind of getting their foot in the door in clinical research. You found a great way to do that through an internship. How did that come about?
It was actually one of the, like the career counselors at at colleges that they have.
Hmm.
So she was helping me trying to find a job after graduation, and she came across this position, and they were actually coming to NC State for a job fair. Once they came to the job fair, she was just like, I think this will be a great position for you. I know you've been looking for everything. So I applied for the position. I got the internship. Once I was in the internship, we just pretty much did everything to learn about the role of the CTA and work with CTAs throughout. After my internship was over, we had the chance to interview for the job to become a CTA at Quintiles, and I was able to get that position.
Okay, that's awesome. So how long did you say the internship was?
The internship was for 3 months, so it was just a summer one.
Okay. And did you have any experience in clinical research or bench research or anything before that? Or that was your first really acclimation to anything research oriented?
I did not have any experience with clinical research. I had experience with like public health research. I had did a little bit couple internships with public health research, but none with clinical research at the time. So this was my very first experience. But I did have the science background from my studies while in college.
Okay. And you majored in human biology, right?
Yeah, no, I majored in biological sciences and then nutrition. So,
Okay, you did the nutrition concentration.
hmm
All right. So a lot to unpack there. Do you feel like your prior experience kind of helped you get that internship? Your prior like public health internships or prior like just needing a bio degree kind of helped you get that initial industry start?
I do feel like it did help. I do think that with having that science background, it definitely helped because when they put these positions up, they do look for people with science backgrounds a lot of the time. Maybe in the past they weren't so specific, about having the science background, but now when you look at the posts more and more nowadays, they wanted some type of science related field as your background.
Right.
So I think that when I applied around that time, they were kind of moving towards that. So I think it definitely helped that I had that experience. And then I think that it helped that I already had, even though it wasn't clinical research experience, I did have some type of research experience with the public health department that I worked with.
Right. Okay. Okay. Now, just for some context, because you did reveal some dates there, it's 2018 now. So if anyone's listening to this in the future, it is 2018 now. And you initially got the internship in what year?
In 2014.
Okay, 2014. So industry was a lot different back then. Changed a lot over the few years. But so you did that 3-month internship, and then did they immediately offer you a job after that? Like, were you a senior in college when this was happening? Take us
No,
through that.
I had actually graduated from school, and so I was in the process of looking for a permanent position, and I came across the internship. So this was after I had graduated, and I was in the
Okay.
internship. It wasn't a promise that we would get hired because it was other interns hired at the same time, but
Right.
you would have to. Your performance has to be well, your manager has to recommend you, things like that. And I ended up getting hired on full time.
Okay. Now, were there other interns that were with you, or was it just like you, the only intern?
No, there were other interns with me.
Okay. All right. So for someone else who is looking to kind of get their foot in the door, would you recommend that same internship, or have you heard about other internships that are better or?
I have not heard about other internships because this was the first time I had even heard about just this industry in general when the career counselor brought it to my attention.
Mm-hmm.
So I wasn't really looking in this industry for jobs, period. So it was the first time that I had heard about it. As far as me hearing about other internships, I don't really hear about other internships. I have heard about like different training programs that the companies may have for
Right.
like the CRA role, but not necessarily internships. I'm
Right.
sure they do have them, but I just, I just wasn't looking for them. So I can't say if they do or not.
Right. Yeah, internships are very, very hard to come by in this field. And I know different companies have them because I know the company that I'm employed by has them also, but they're very, very hard to come by. I think they may have some partnerships with some schools for people to like kind of slide in there that way. But other than that, I don't think they post them on the website with like a big like apply here link or anything like that. It's kind of secretive.
Exactly. Especially when you want to get into like the CRA department, like that department of the company, because I've seen multiple and I've had multiple friends go from college and do like the finance internships at the same company. Like they have a lot of those postings.
Right.
But as far as like the clinical department postings, it's not a lot.
Right. Yeah, I don't know why that is, because obviously interns can do a lot of good work in the clinical department, and there's obviously a big need for people in the clinical department or just in clinical research in general. So
Yeah, no, definitely. There's definitely a high need for clinical research associates in all areas.
yeah, not just CRAs, everything is needed. I've worked on plenty of studies where, some
Very
project
true.
managers are needed. They need project
Very
managers.
true.
They need project managers, assistants. They need other stuff. So,
Very true, because a lot of them are stretched thin as well.
right.